I'm Dr.H.K.Chopra, Senior Consultant Cardiologist, Medanta Moolchand Heart Institute, former National President of CSI and Indian Academy of Echocardiography, and Country Head of American Heart Association. Thank you, Poonam. I think it's really a great pleasure to be here on the occasion of World Hypertension Day. And this word is being coined by World Hypertension League. The theme is very well known to all of us, that measure your blood pressure, control it, and live longer. The question asked to me is very, very important. How to control your blood pressure? How to measure your blood pressure? That is the first component of the theme. So measurement of blood pressure at home is of a paramount importance. We should know how to measure the blood pressure, because the blood pressure at home is the ideal measurement of blood pressure. Because you are in the home environment, there is no stress factor, there is no component of so-called white coat hypertension, there is no stress. We can measure the blood pressure in the morning hours, in the evening hours. When we are totally stress-free, we can use a digital method, which is a very accurate method. You don't need to learn the technique of measure the blood pressure, but there are some precautions. And these precautions are, we should sit in an ideal position to take your blood pressure. We must make sure that we are not in a stressful mood. We are in a very relaxed mode. And number 3, we should not have any kind of excessive alcohol or tea or coffee or smoking. And I could have adequate sleep. Once you are in adequate sleep and you are in a natural environment, you will have an ideal blood pressure. I firmly believe that home blood pressure monitoring is the future. I check my blood pressure every day in the morning at 6 o'clock when I am totally relaxed. And that is my measure of blood pressure by which I keep a control. So I think it's a very, very important theme of the World Hypertension League. Measure your blood pressure, because that is the only way to control your blood pressure, by optimizing your lifestyle and drug intervention. I think it's very important that we all should know that India is the world capital of hypertension, diabetes, high cholesterol, heart attacks, obesity, and whatnot. A time has come, we have to have a paradigm shift from illness to wellness, so that India should be recognized as the world capital of wellness. So what Poonam is talking to me is talk of hypertension wellness, because uncontrolled hypertension is like a global tsunami. When I say global tsunami, means uncontrolled hypertension has a devastating effect on our system. It may cause heart attack, it may cause eye attack, it may cause nose attack, it may cause brain attack, abdominal attack, and leg attack. What not? It's a silent killer. So it's very important. Hypertension can affect adversely the heart. It can cause a hypertrophy of the heart muscles. It may cause breathlessness or a heart failure, what we call as diastolic heart failure. It can produce acute coronary syndrome, unstable angina, and a massive heart attack. Even the remodeling of the heart can be seen. All the chambers can be enlarged. It may cause vascular stiffness. It may cause dissection of the aorta. So every possible complication, like a brain hemorrhage or hemorrhage from the nose or eye hemorrhage, are known with the uncontrolled hypertension. Therefore, the control of hypertension is the need of the hour. It is the very, very powerful predisposing factor for all kind of attacks which I just mentioned. I think it's a very, very important point. We are in the COVID era. And it has been mentioned very clearly that COVID is pro-inflammatory, pro-thrombotic, and pro-immunogenic. It can totally track our body right from the head to the toe. The question you asked is how COVID attacks heart. The COVID can cause a heart attack by causing clotting in the coronary arteries. It may cause myocarditis, may also cause tachycardia, atrial fibrillation, and even sudden cardiac death and pulmonary embolism. We see so many patients who had a hypercoagulability in the whole system. They may get DVT, clotting in the veins, clotting in the arteries, may get a heart attack and a brain attack simultaneously. Since it is a pro-clotting virus, the thrombus formation is very, very important, which we must consider in all the patients. We know that the patients who are victims of hypertension are 40% at the age of 40, 50% at the age of 50, 60% at the age of 70, and 90% of the patients at the age of 80 are hypertensive. And on the top of it, if they get COVID, they will have a high morbidity and mortality. Therefore, control of blood pressure is the need of the hour, especially in the COVID era, because it may aggravate inflammatory process and thrombotic process. It may accelerate the hypertension and hypertension related complications. So a very important message, blood pressure should be controlled during the COVID time as well as during the vaccination and even after the vaccination. I think it's a very, very pertinent question in the COVID time. Any person who is hypertensive, controlled or uncontrolled, if he or she, young or old, men or women, get COVID with uncontrolled hypertension, the morbidity and mortality is going to be very high. The reason is, it is twofold. Number one, virus itself, and number two, the treatment we give. A lot of our patients are on steroids, and the steroids may increase the blood pressure as well as increase the sugar levels. So those who are diabetics and those who have CKD underlying, or those who are uncontrolled hypertensives, their morbidity and mortality can be very, very high. So we have to make sure that all the non-pharmacological methods to control the blood pressure are necessary. For example, I always say 7 S should be remembered. First S is salt reduction. Number 2, reduction of saturated fat. And number 3, reduction of sugar consumption. And number 4, we must be mobile. Sedentary habits are predisposing factors. Stress, we must make sure one is never angry. COVID attack should not be a panic attack. COVID attack should not be an anxiety attack. And COVID attack or COVID pandemic should not be a chaotic pandemic. They are very, very important methods of relaxing ourselves so that we are away from stress and we sleep adequately. Avoid sleep apnea. So these are all the 7 or 8 S, no smoking, a very, very important S by which we can control the blood pressure non-pharmacologically, and pharmacologically also is very important. All the patients of hypertension during COVID time should make sure continue the medicines, whether it's in ARB or ACE inhibitors or calcium channel blockers. 2 calcium channel blockers are very commonly used. One is amlodipine and second is Zevlon, which is a new one coming up in the market. It is also a very important calcium channel blocker. We can give in the evening or in the morning 8 mg twice a day, or amlodipine we can give 5 mg morning and evening. The only disadvantage of amlodipine is some people may get pedal edema. So that's a little disadvantage of amlodipine as compared to Zevlon, where we don't see any pedal edema because of the different channels of the kidney it acts as compared to amlodipine. So beta blockers are very important. One should continue. Statins, one should continue. And if a person is on antiplatelet drugs like cyclosporine, please continue drugs. As I mentioned to you, it's a prothrombotic virus. And if you're on a drug like Novak, for example, rivaroxaban, if anybody is on rivaroxaban because of atrial fibrillation, we should continue rivaroxaban. And the second very important message is rivaroxaban is the need of the hour during COVID time. I personally believe from the day 1 to 6 to 8 weeks, one should take rivaroxaban at least 10 milligrams after lunch as a prophylactic. But if a person has got an obvious thrombotic manifestation in the form of DVT or MI or pulmonary embolism, they can be given initially enoxaparin or heparin or thrombolytic therapy followed by rivaroxaban 10 milligrams to 20 milligrams after lunch to continue at least for 8 to 12 weeks as a treatment strategy. So there are prophylactic strategy and there is a treatment strategy, and there should not be any confusion. Whether should we take antiplatelet or not? Should we stop anticoagulants? No question of stopping. Please continue anticoagulants, especially Novak like rivaroxaban, because there is a huge data to support. Whether it's a record study or it's an Epstein study, huge data is there to support the usefulness of anticoagulants. Similarly, statins, all the statin, atorvastatin or rosuvastatin is also pleiotropic effect. And since they have pleiotropic effect, they are anti-inflammatory effect and lipid lowering effect, they also add to the prognosis of hypertension and COVID infected morbidity and mortality. It's a very, very important question. In fact, I created a protocol, and recently I appeared on the television, and 3 crore people have seen this. And my aim was proper protocolization of the management of COVID is the need of the hour. And the protocol was divided into 3. Pre-COVID, in the COVID era, during COVID, and post-COVID. Pre-COVID means taking all the measures, which we all know, universal precautions, like social distancing or putting a face mask and using the sanitizers, very, very important. And taking vitamins D and C and zinc as a preventive measure. During COVID, again we divided 2 components, first 7 days and the last 7 days. First 7 days, we have to continue antibiotics and cough syrups and all additional supportive treatment. But it is the last 7 days or the second 7 days where the cytokine storm takes place. It is this cytokine storm which is responsible for injury in the lung, injury in the myocardium, injury in the blood vessels, and may cause thrombosis anywhere and may also aggravate hypertension. So we must ensure that cytokine storm is taken care of, for which we give steroids as an anti-inflammatory agent. It should not be given for a long time. Some people, they give steroids for a pretty long time. It may cause increased proneness to the bacterial infection or so-called a black fungus or mucormycosis. So you have to be very careful that you have to give a thorough protocol because patients are hypertensive and diabetics. So the dosage of steroids should be meticulously planned under a strict vigilance. Then of course we use remdesivir to reduce the virus load. And the third thing which we do is we use these days monoclonal antibodies. Again, the supervision of the doctors in the hospital. And regarding plasma therapy, what we call a CP or convalescent plasma therapy, we don't recommend it much because the data is not supportive. The safety and efficacy is also not known. Post-COVID is a very important question you asked me. And the post-COVID, we have a protocol. And this protocol is created by me. And the protocol is like this. I do complete inflammatory marker analysis in the form of CRP, in the form of D-dimer, and we also do procalcitonin, and we also do interleukin and ferritin. The normal CRP is less than 6. I did my own classification, 20 to 40, 40 to 60, and more than 60. we grade them grade 1, grade 2, and grade 3. Similarly, IL-6 normally should be less than 7. So we say 3-fold rise, or 6-fold rise, or 9-fold rise. And we give the severity of the COVID during COVID time and post-COVID also. Third is the interleukin. Interleukin I already mentioned, ferritin levels. So similarly again, baseline, then 3-fold rise, 6-fold rise, and 9-fold rise. Next is CT scan. CT scan scoring understanding is very important because we have 20 segments in the lung and we score it. If the score is less than 9, it's mild, and 9 to 14 is moderate. If it is more than 14, it's a severe lung involvement. And based on that, our post-COVID care is planned. What I do in my hospital, I do this inflammatory evaluation, and I also do a total vascular doppler, where I do a color flow of carotid vessels. I see the stiffness of the carotid arteries and the flow profile. I do a complete cardiac evaluation. I also do a peripheral arterial venous evaluation because it has been reported worldwide that 18 to 20% of patients may have occult deep vein thrombosis. If you find thrombosis anywhere, we have to regulate the dose of NOAA. So please make sure that all of us, those who are COVID victims or doctors who see the COVID patients, they subject them for proper protocolization and regulate the medicines by controlling the inflammation and by controlling the pro-thrombotic state in a patient, and don't advise them to go for a vigorous exercise. Like a treadmill, I've seen a lot of my patients while doing exercise on third day after recovery, drop dead. I see a lot of young people coming to me at the age of 32 and 34 with sudden cardiac death because they did not take any anticoagulants. So anticoagulants is also the need of the hour, and control of hypertension is also the need of the hour. So all hypertensives and diabetics who have COVID, they should follow a protocol. The time has come, proper protocolization is the need of the hour. It's a very important question, Poonam, which you asked. I've got 10 messages. My first message is everyone should know that uncontrolled hypertension is a global tsunami. It can cause heart attack, brain attack, eye attack, nose attack, leg attack, and abdominal attack. Number 2, everybody should know hypertension is a silent killer. And number 3, which is very important, and I say everyone that please measure your blood pressure daily up to the age of 30 or 40 at home, ideally home blood pressure monitoring. Ambulatory blood pressure monitoring is the domain of a doctor. I also say an appeal on this day to the government of India, we must provide kiosk so that everybody can put it in the hand and can make the blood pressure, and they can get a digital printout to know, just like a weighing machine, which is also the need of the hour. I also appeal on this particular day that we must enhance hypertension awareness by a method which IPCA has adopted today in the form of digital, print, or electronic methods, or even using an app like a hypertension care app, which is a hypertension awareness. Like IPCA has launched a hypertension care mission on the television, which is also a very, very important campaign to enhance the awareness about the hypertension. The fourth thing which I wanted to mention is grow younger and live longer with a normal blood pressure till the age of 80. And also mention that anybody get a hypertension below the age of 70, it is his or her own fault. After 70, it's a God's will. I would also like to say that shorter is the waistline, normal is the blood pressure number. I would also like to say a very important message. What we eat definitely matters, but what is eating us matters more. In Hindi, we call it Chinta Chita hai. please manage your stress of daily life. And number 4, have adequate sleep. Those who sleep adequately, they don't fall victim to hypertension. Please sleep. Please relax. And don't consume extra salt, no extra sugar, and no extra smoking, no alcohol. As I mentioned to you, all those 7 or 8s, they are to be followed. They are very, very important. I also say how long you live with hypertension is all right, but how well you live with the hypertension really matters. So these are very, very important messages which I wanted to give. And the last message, which is very important for all of you, that we must act vocally as it is happening today, locally, focally, to impact globally. And the last message is inform, perform, reform, and transform the whole world with a normal blood pressure to prevent hypertension, infected morbidity, and mortality. I compliment IPCA for such a project, a very versatile project, taking messages and making clipping of the messages and showing every day as a World Hypertension Month. Thank you very much for giving me the opportunity, Poonam. I'm very grateful to you.